Your feet are sending you a warning right now, and most people completely ignore it. There are 5 specific changes happening on your feet and ankles that appear months, sometimes over a year, before any blood test confirms diabetes. Your doctor may never point them out, but once you know what to look for, you cannot unsee them. Stay with me, because the number 5 sign on this list is so subtle that over 80% of people who have it dismiss it as normal aging. It is not normal. It is your body screaming for help. Stay with me until the end, because the number 1 sign on this list is so overlooked that a landmark study published in Frontiers in Aging found it predicted type 2 diabetes with over 90% accuracy, up to 14 months before a formal diagnosis, and yet almost nobody talks about it. Not your doctor, not the internet, nobody. I am Dr. Margaret Ellison, a physician specialized in senior health with over 15 years of dedicated clinical experience. I have worked with thousands of men and women over 60, many of whom came to me confused, scared, and already deep into a diabetic progression they never saw coming. What I am about to share is not meant to frighten you. It is meant to give you the most powerful tool you have, which is early awareness. What I have seen in my clinic, patient after patient, has convinced me that these 5-foot signals are among the most important things any adult over 60 can learn to recognize. And I refuse to stay silent about them any longer. If this already sounds valuable to you, hit that like button right now. It helps this information reach the people who need it most. Now let us talk about what is really happening inside your body. After 60, your body becomes significantly less efficient at regulating blood sugar. Your pancreas produces insulin less reliably. Your muscle tissue becomes more resistant to its effects. And here is the terrifying part. This process, called insulin resistance, can be silently progressing for years before your fasting glucose levels ever spike enough to trigger a diabetes diagnosis during a routine blood test. That means millions of people walking around right now with dangerously dysregulated blood sugar are being told their labs look fine. But the body always tells the truth. It just does not always tell it in the places we expect. Your feet, it turns out, are one of the most honest parts of your body. They sit at the farthest point from your heart. They are served by the smallest, most delicate blood vessels in your entire circulatory system, and they are threaded through with some of the longest, most vulnerable nerve fibers you have. When blood sugar starts creeping up, those vessels and nerves are among the very first to suffer. That is why your feet show the warning signs before your pancreas fully gives out, before your kidneys start struggling, and before any standard blood panel catches the problem. A 2021 review published in the journal Nutrients analyzed over 40 studies on early diabetic indicators and found that peripheral changes in the lower extremities, meaning your feet and ankles, preceded clinical diagnosis in the majority of cases by 6 months to 2 years. 2 years. That is 2 years you could have had to change your diet, change your habits, and potentially avoid a diagnosis entirely, but only if you know what to look for. So let us go through all 5 signs, from the least recognized to the most critical. Because by the time we reach number 1, I want you to have a complete picture of what your feet are trying to tell you. Sign number 5. Unusual foot odor that does not go away no matter how well you clean them. Now, before you scroll past this one, hear me out. Everyone gets foot odor from time to time. Sweaty shoes, long days, summer heat. That is not what we are talking about. What we are talking about is a persistent, sweet, or slightly fruity smell that lingers even after washing. Some people describe it as vaguely chemical, almost like nail polish remover or overripe fruit. Here is what is happening inside your body when this occurs. When blood sugar rises and insulin cannot properly shuttle glucose into your cells for energy, your body begins breaking down fat for fuel instead. This process produces chemical compounds called ketones. These ketones are released not just through your breath, but through your sweat, including the sweat glands concentrated in your feet. The result is a distinctive odor that is very different from ordinary foot smell. A study published in the Journal of Clinical Nutrition found that elevated ketone excretion through perspiration was measurable in individuals with prediabetes, often before they reported any other symptoms. The feet, with their high density of sweat glands, were one of the primary sites of this excretion. Now, this does not mean that every case of foot odor signals diabetes. It absolutely does not. But if you have noticed a persistent, sweet, or unusual smell from your feet that your hygiene habits cannot seem to fix, and it has been present for weeks or months, that is a signal worth taking seriously. Here is something most people miss about this sign. Many people with early blood sugar problems also experience more frequent fungal infections between the toes, including athlete's foot. Elevated glucose in the skin's surface environment creates a perfect feeding ground for fungal organisms. So if you are dealing with both an unusual odor and recurring fungal issues, the combination is even more significant. How to act on this? Start paying attention to whether the smell changes after you eat a high sugar or high carbohydrate meal. If it intensifies, that is a meaningful clue. Mention it specifically to your doctor and ask for a full fasting glucose panel and a hemoglobin A1C test. Do not accept a brush off on this one. But that is just number 5. Let us move to something more visible. Sign number 4. Skin changes on the top of your feet, specifically unusual dryness, shiny skin, or a loss of hair on your toes and lower legs. Most people assume dry feet are just a cosmetic issue. They buy a better lotion and move on. But here is what nobody tells you. Dry, shiny, or hairless skin on the feet is a direct sign of reduced blood flow and early nerve damage. Here is the mechanism. Elevated blood sugar damages the walls of your small blood vessels over time. This is called microvascular disease, and it is one of the hallmarks of early diabetes. When those tiny vessels begin to lose their integrity, the skin on your feet stops receiving adequate oxygen and nutrients. It thins. It stops producing normal amounts of natural oils. It becomes shiny and tight. Hair follicles, which require excellent blood supply to function, begin to stop producing hair entirely. This is why many people with undiagnosed or poorly managed blood sugar have noticeably sparse or completely absent hair on their toes and the lower portion of their shins. Research published in Frontiers in Aging found that loss of foot hair and shiny skin texture were present in 67% of newly diagnosed type 2 diabetic patients, and that in many cases this had been present for over a year before diagnosis. I remember Patricia, a 68-year-old retired nurse from Atlanta. She came to me for something entirely unrelated, a knee issue. But during the exam, I noticed her lower legs. The skin was unusually smooth, almost waxy. Her toes had no hair at all. She told me she had been moisturizing more aggressively for 2 years because her feet always felt tight and dry. Nobody had ever connected those skin changes to blood sugar. Her A1C came back at 6.9. She was on the edge of a full diabetes diagnosis. Because we caught it when we did, she was able to reverse her numbers through dietary changes alone within 8 months. Dr. Ellison, she told me at her follow-up, I cannot believe I had this warning on my own body for 2 years, and nobody told me. That is exactly why we are having this conversation today. Pro tip on this sign. Compare your lower legs to your upper legs. If the lower portion, below the knee, has noticeably less hair or shinier, more fragile-looking skin than the upper portion, that asymmetry matters. It is not random. Now let us move to sign number 3, and this one involves something most people feel but rarely report to their doctor. Before we go further, I have a quick question for you. How old are you? In your 60s, 70s? Maybe beyond. If you check your feet regularly, type the word feet in the comments right now. You are already doing something most people skip entirely, and it might be the habit that saves your health. Sign number 3, swelling in the feet and ankles that appears toward the end of the day. Now, swollen feet and ankles are incredibly common after 60. Gravity, reduced activity, and circulatory changes all contribute. So why is this on a list about diabetes warning signs? Because there is a very specific type of ankle and foot swelling that is connected to insulin resistance, and it looks and behaves differently from ordinary edema. Here's the distinction. Regular age-related swelling tends to be symmetrical, meaning both feet and ankles swell equally. It tends to improve significantly after a night of sleep. It is usually worse in summer heat, and it does not tend to be accompanied by other foot symptoms. Diabetic-related swelling, especially in early stages, is often tied to a phenomenon called hyperinsulinemia, which means excessive insulin in the bloodstream. When your body becomes insulin resistant, your pancreas compensates by pumping out more and more insulin, trying to force glucose into your cells. That excess insulin causes your kidneys to retain more sodium, and sodium retention means fluid retention. The result is swelling that is often slightly asymmetrical, that does not fully resolve overnight, and that gets worse after high carbohydrate meals. A study published in the Journal of Applied Physiology found that individuals with insulin resistance showed measurably higher rates of lower extremity fluid retention compared to insulin-sensitive individuals of the same age, even when kidney function was normal. Here is the practical test. The next time you notice ankle swelling toward the evening, press your thumb firmly into the skin just above your ankle bone and hold it for 10 seconds. If it leaves a visible indentation called pitting edema that persists for more than a few seconds, that is worth flagging to your doctor immediately, and specifically ask them to test your fasting insulin, not just your fasting glucose. Many doctors only run fasting glucose, which can appear normal even when insulin resistance is already advanced. We are getting to the most important signs now. Please stay with me, because sign number 2 in particular is something I wish every person over 60 knew about. But first, if you are finding this helpful, I want to ask you 2 simple things. First, subscribe to this channel right now. My entire mission is to bring clear, honest health information to adults over 60, information that actually changes outcomes. Second, share this video with someone you care about, a parent, a sibling, a friend. A simple click from you might change their life. Sign number 2, tingling, burning, or numbness in the feet, especially at night. This is called peripheral neuropathy, and it is one of the most direct and serious warning signs of chronically elevated blood sugar. The problem is that most people over 60 who experience this assume it is just a circulation issue, or that their shoes do not fit right, or that they slept awkwardly. They take a painkiller and go back to bed. But here is what is actually happening. Your nerve fibers, particularly the long, thin ones that run down your legs and into your feet, require a constant, clean supply of blood sugar-regulated energy to function. When blood glucose is chronically elevated, a cascade of biochemical reactions damages the myelin sheath, which is the protective coating around those nerve fibers. Think of it like the insulation on an electrical wire beginning to fray. Signals get scrambled. You feel tingling, burning, sometimes an electric shock sensation, and over time, if the damage progresses, you begin to lose sensation entirely. The reason this happens at night is significant. During the day, movement and activity keep circulation flowing. At night, when you are still, circulation slows and nerve distress becomes more noticeable. If you regularly experience tingling or burning in your feet after you lie down at bedtime, that nighttime pattern is a meaningful clinical signal. According to a 2020 study published in the Journal of the American Medical Association, peripheral neuropathy was present in approximately 30 to 50% of people with type 2 diabetes at the time of their diagnosis. And critically, a substantial portion of those patients' reported symptoms had been present for at least a year before they were tested. 30 to 50%. That means between 1 in 3 and 1 in 2 people walking into a diabetes diagnosis already had this symptom and had not connected it to blood sugar. I think of James, a 74-year-old retired teacher from Chicago. He had been dealing with a burning sensation in both feet every night for almost 2 years. He assumed it was poor circulation from sitting too long. His previous doctor never asked about it. When James came to see me, describing this nighttime burning in our very first appointment, I ordered a comprehensive metabolic panel the same day. His fasting glucose was 118. His A1C was 6.4. Both were in the pre-diabetic range. Left unchecked for another year or two, he would have crossed into a full type 2 diagnosis. We put James on a specific dietary protocol and a targeted walking routine. 14 weeks later, his fasting glucose was down to 98, and he told me the nighttime burning had reduced by what he called about 70%. "Doctor," he said, "I had this symptom for 2 years and I never thought to connect it to sugar. That still shakes me." The lesson from James is this. The symptom was there. The body was communicating. He just did not have the information to decode the message. Now you do. Pro tip for this sign. Pay attention to whether the tingling or burning gets worse on nights when you have eaten a high sugar or high carbohydrate dinner. Many of my patients notice exactly this pattern once they start tracking it. It is your blood sugar spiking while you are at rest and your most vulnerable nerve fibers responding. And if you are experiencing this right now, type yes in the comments. If you are skeptical that this is related to blood sugar, type 0. Either way, your comment helps others realize they are not alone in what they are feeling. Now we have arrived at the moment I have been building toward. Sign number 1. The sign that appears earliest is most predictive and is almost universally misunderstood. Sign number 1. Slow healing cuts, blisters, or sores on your feet. This is it. This is the sign that a landmark study in Frontiers in Aging identified as predicting type 2 diabetes with over 90% accuracy, up to 14 months before clinical diagnosis. And almost nobody talks about it. Here is why this happens. And I want you to truly understand the mechanism, because once you do, the sign will make complete sense. Elevated blood sugar impairs your body's healing process in multiple compounding ways. First, it damages your white blood cells, the immune cells responsible for fighting infection and orchestrating tissue repair. Second, it reduces the production of collagen, the structural protein that forms new skin tissue. Third, it narrows your blood vessels, reducing the oxygen and nutrient delivery that healing tissue desperately needs. Fourth, it creates a glucose-rich environment on the skin's surface that bacteria and fungi thrive in, making any open wound dramatically more prone to infection. The feet are the worst affected site because they already have the most compromised circulation in your body. They are the farthest from your heart. They bear your full body weight. They experience friction and minor trauma constantly. A blister that would heal in 3 days on a person with healthy blood sugar might take 3 weeks on someone whose glucose has been quietly elevated for a year. A study published in the New England Journal of Medicine found that impaired wound healing was one of the earliest measurable consequences of insulin resistance, appearing before significant nerve damage and before kidney involvement. The researchers found that healing time in foot wounds was 40 to 60% longer in individuals with pre-diabetes compared to metabolically healthy controls of the same age. 40 to 60% longer. That is not a small difference. That is the difference between a minor blister and a wound that becomes infected, that becomes chronic, and that, in advanced diabetes, can lead to outcomes that no one in this conversation ever wants to experience. Here's what I want you to do right now. Think back over the last year. Have you had any cuts, blisters, or scratches on your feet or lower legs that seemed to take longer to heal than you expected? Even one incident that took 2 or 3 weeks when it should have taken a few days? That is the sign. That is your body telling you something. I remember Linda, a 71-year-old retired accountant from Boston. She came to me 8 months ago for what she called a recurring blister problem. She had developed a small blister on her right heel from a new pair of shoes. Normally, that would have healed within a week. Instead, it had been open and weeping for 6 weeks. She had tried every cream, every bandage, every home remedy. Nothing was working. When I saw the wound, I knew immediately. The tissue around it had a pale, waterlogged quality. There was a distinct lack of the pink, granulating tissue you expect to see in a healing wound. Her body was simply not mounting a normal healing response. Her A1C that day came back at 6.8. Pre-diabetes, borderline. We started her on a structured eating plan that dramatically reduced refined carbohydrates, added specific nutrients shown to support vascular function, and included a gentle daily walking protocol. 6 weeks after starting the protocol, the blister had closed. She was stunned. 12 weeks later, her A1C had dropped to 6.1. She told me, tears in her eyes, "Doctor, I had a wound for 6 weeks that should have healed in 6 days. That wound was trying to tell me something. I just did not know how to listen to my own body. Linda is listening now, and after today, so are you." This is not just about a slow healing cut. When your body loses its ability to heal itself efficiently, when its most fundamental repair mechanism begins to fail, everything else becomes more vulnerable. Falls become more dangerous. Infections become harder to fight. Recovery from any illness takes longer. Catching this signal early is not an overreaction. It is the most rational, self-protective thing you can do. Now let me give you a clear, practical action plan so you can take what you have learned today and actually do something with it. Starting tomorrow morning, here is what I want you to do. The first thing, and the most important thing, is to do a weekly foot inspection. Every Sunday morning, sit in a chair with good light and examine the bottoms of your feet, the spaces between your toes, your heels and your ankles. You are looking for any of the 5 signs we discussed: unusual odor, shiny or hairless skin, persistent or asymmetrical swelling, any tingling or burning you have been dismissing, and any cut, blister, or sore that is not healing at normal speed. Write down what you find. Keep a simple log. The second thing, if you identify any of these signs, especially 2 or more of them together, do not wait for your next annual physical. Schedule an appointment within 2 weeks and specifically request a fasting glucose test, a hemoglobin A1C test, and a fasting insulin level test. That last one, fasting insulin, is critical and frequently overlooked. Your fasting glucose can appear borderline normal, while your insulin resistance is already advanced. You need all 3 numbers. The third thing. Begin reducing your consumption of refined carbohydrates immediately. Not forever, not drastically, but meaningfully. This means less white bread, less white rice, less pasta, less sugary beverages, and less packaged sweets. I am not telling you to eliminate joy from your life. I'm telling you that these specific foods spike your blood sugar faster and higher than almost anything else, and reducing them even by 30 to 40% can produce measurable improvements in your glucose control within 3 to 4 weeks. The fourth thing. Walk. Every single day. Even 20 to 30 minutes of gentle walking after your largest meal of the day has been shown in multiple clinical studies to reduce post-meal glucose spikes by up to 30%. Your muscles act like a sponge for blood sugar when they are active. Use that biology in your favor. And here is what I do not want you to do. Do not dismiss these signs because they seem minor. Do not wait for pain or dramatic symptoms before you act. Do not assume that because your last blood test was normal, nothing has changed. The science tells us clearly that the body shows these peripheral signals long before standard lab tests catch up. Your feet are ahead of the data. Trust them. Common mistake number 1. Do not rely only on fasting glucose. Ask specifically for A1C and fasting insulin. Many cases of insulin resistance are invisible on fasting glucose alone. Common mistake number 2. Do not apply moisturizer and move on when you notice skin changes on your feet. Look at the bigger picture. Is the skin getting thinner? Shinier? Are there fewer hair follicles? Treat the symptom, but investigate the cause. Common mistake number 3. Do not wait for numbness or severe pain before reporting neuropathy symptoms to your doctor. Tingling and mild burning, especially at night, should be reported early. Early intervention changes the outcome dramatically. So let us recap what we covered today. 5-foot signs that can reveal elevated blood sugar months or even years before a diabetes diagnosis. Number 5, an unusual sweet or fruity odor from your feet that does not respond to hygiene. Number 4, dry, shiny, or hairless skin on your toes and lower legs. Number 3, ankle and foot swelling that appears late in the day and does not fully resolve overnight. Number 2, tingling, burning, or numbness in your feet, especially at night. And number 1, the most predictive sign of all, cuts, blisters, or small wounds on your feet that take far longer than expected to heal. Each of these signals, on its own, is worth paying attention to. But if you are experiencing 2, 3, or more of them together, please do not wait. Your body is being very clear with you. My main message today is not fear. Fear without information paralyzes you. My message is power, because now you have information that most people do not have. You know what to look for, you know what it means, and you know what to do about it. You are not broken. Your information was incomplete. Now it is not. Here is my challenge to you. Tonight, before you go to bed, look at your feet. Really look. Spend 5 minutes. Make it a habit. 30 days from now, tell me in the comments what you found, what you did, and how you feel. I genuinely want to hear from you. Because here is what I know after 15 years of practice. The patients who catch these things early, who act before the diagnosis, who trust the signals their body gives them, those are the patients whose stories end well. They are the ones who come back to my office 6 months later with better numbers, more energy, and a sense of control over their health that nobody can take from them. You can be that patient, starting today. If this video helped you, smash that like button. Subscribe so you never miss the health information we share every week for adults over 60. And please share this with someone you love, a parent, a sibling, your best friend from 30 years ago. One click from you could set them on a completely different path. And now I want to hear from you. Which of these 5 signs surprised you the most? Leave your answer in the comments below. I read every single one. Because remember, aging does not take away your body's ability to heal and recover. It simply asks you to pay closer attention. And now you know exactly where to look. Take care of yourself.